Hello everyone. So in today's video, we will continue our screening guidelines lecture. It's the part 2 of the screening guidelines. In the first video, I described some of the conditions which needs to be screened, and in the second video, we will continue with some other conditions which needs to be screened. So the first one in this part is abdominal aortic aneurysm. What sort of patients need to be screened for abdominal aortic aneurysm? These are men who have ever smoked or men who have ever a history of smoking. The screening for women having history of smoking is not recommended. The test of choice for abdominal aortic aneurysm screening is abdominal ultrasound. The age limit is between 65 to 75, and the frequency is once in a lifetime after age 65. As ultrasound is less expensive than CT and MRI, and it also give protection to the patient from extra radiation. So, and it's an easy, convenient test for the patient. So this is why abdominal ultrasound is recommended for the screening of abdominal aortic aneurysm. After abdominal aortic aneurysm comes the disease diabetes mellitus, and it's such a disease that if it is diagnosed well in time, the long-term prognosis, the long-term complications could be decreased to very bigger values. So the test of choice for the screening of diabetes mellitus, it's fasting glucose levels, HbA1c, or oral glucose tolerance test. The age limit is 35 to 70, and we screen for diabetes mellitus every 3 years. It is recommended for overweight or obese individuals. By overweight, I mean BMI of 25 or greater, or by obese, I mean BMI of 30 or greater. So it's a very important topic, and it usually come in exams, and every point like age, frequency, the type of test, it's itself in is an MCQ, an option, and you should remember every one of that because you can be tested in any one of these ways. After that comes hyperlipidemia. In hyperlipidemia, there comes associations of hyperlipidemia because it's associated with multiple conditions like diabetes, hypertension, carotid artery disease, coronary artery disease, carotid disease, peripheral vascular disease, and aortic disease. In patients and individuals who don't have any relation to it, these conditions, the age is in men is 35 and in women is 45. But if any one of these conditions is associated, the screening should be started from 20 years and above. The test of choice for the screening of hyperlipidemia is lipid profile, and the frequency for both of the conditions, like with risk factors, with associations, or without, is every 5 years. And it's also very important because hyperlipidemia, there comes hypercholesterolemia, there comes hypertriglyceridemia, and everyone has its own way of treatment, everyone has its own modification, lifestyle modification. So a lipid profile will give us a better view, better image of what sort of treatment or what sort of lifestyle modification should be done. Next comes hypertension, and the test of choice for hypertension screening is blood pressure measurement. And the screening should be started at age greater than 18 every 2 years, because in most and 90% of the cases, hypertension is asymptomatic. The patient might be hypertensive, but if he or she is not screened, then it can lead to long-term complications like myocardial infarction and stroke and many other conditions. So hypertension is also a very important topic to be in screening, because most of the our students are not aware of the fact about hypertension screening. After that comes osteoporosis, and the test of choice for osteoporosis is DEXA scan. By DEXA scan, I mean dual energy X-ray absorptiometry. The age, there comes two types of conditions. If age is less than at age in postmenopausal women, and age less than 65, and in and age greater than 65, and yeah, it gives us findings with T-score. T-score of 1 to 2.5 standard deviation below the normal is osteopenia, and a T-score of greater than 2.5 standard deviation below normal is osteoporosis. So both are actually deficiency of calcium, deficiency of vitamin D, deficiency in bone making, in bone formation and increased bone resorption, but there comes a T-score, and it gives us what sort of treatment will we begin, and what type of aggressive, whether we will show when we will treat with aggressive therapy, or we will treat with a moderate therapy. So it will be decided by the T score, as evident by the dual energy X-ray absorptiometry. Screening for osteoporosis is also recommended in some special groups like at age less than 65 in smokers, patients with anorexia nervosa, and patients having premature failure. So if the patients are having at age less than 65, but they are having these conditions like smoking, anorexia nervosa, premature failure, premature ovarian failure, so in such group of individuals, screening for osteoporosis is recommended. After that comes intimate partner violence. It's a very important topic, and you will see some of the MCQs. These are frequently tested on exams, and these are it's a very important topic. So yeah, there is no test for it. The screening in this the screening, and it's actually history based. You should take history whenever in all the childbearing women and all the patients in which you suspect that they might be prone to partner violence. You should be screened by taking history, and but one point which you should remember in difference between intimate partner violence and child abuse is that if you suspect child abuse, you will straightforward, you are ethically and legally authorized to report the case to child protective services. But it's not the case in intimate partner violence, because in intimate partner violence in adults, the report should only be done if the patient is if the patient gives you the consent, the authority or the permission to report it. But if there is not consent, if the patient doesn't allow you, you cannot report the case. So this one difference should be memorized, should be learned, because you could be tested about such cases. Some other points which I wanted to tell you about, because it also comes in exams, that in women aged less than 24 years old, screening annually for gonorrhea and chlamydia is recommended. And in what type of patients will we screen for hepatitis B? We will screen patients who have history of multiple blood transfusions. We will screen patients who regularly undergo dialysis. We will screen patients on long-term chemotherapy, and we will screen transplant patients on long-term immunosuppressant drugs. So these are some of the major points, major topics of our screening guidelines video. And if anyone among you have some points to share, or have some critical views, they should type it on the comment section, and it will be really appreciated. So that was all for this lecture, and we'll discuss new topics in the coming videos.